8 hidden risk factors for heart disease. These days, stress is usually included on the list of major risk factors for heart disease. But there are many risk factors that we often overlook, either because they don't affect as many people or because doctors are only now realizing how dangerous they are. If you have any one of these risk factors, you must pay attention to them and take the actions I set out to mitigate their impact on your heart. If you do not, the result could be deadly. Number 1. Stress. Stress is the body's instinctive response to the perception of a threat. When we sense danger, our adrenal glands release a flood of hormones, including adrenaline and cortisol, into the bloodstream. These hormones quicken the heartbeat and raise blood pressure, pumping additional blood into our arms and legs. That's why this is called the fight-or-flight response. Unfortunately, cortisol also fuels inflammation, which sets the stage for coronary artery disease. Our bodies respond the same way to stress if it is temporary or chronic. For instance, whether we are faced with real sudden danger or an ongoing stress, the effect on the body is largely the same. So if you are under stress, do something to alleviate it. If your job or occupation is the problem, think strongly about making a change. If you can't get rid of the source of your stress, you can do other things like make your lifestyle as heart-healthy as possible. You can eat healthy foods, schedule frequent work breaks, and learn how to relax. Number 2. Gum disease. People have millions of bacteria living in their mouths. When a person has gum disease, that bacteria can get into the bloodstream through open sores. These bacteria then stick to plaque in the coronary arteries, making the narrowing and inflammation even worse. Another potential link focuses on the body's inflammatory response. When you have gum disease, your body is in a chronic inflammatory state, which contributes to the likelihood that atherosclerotic plaque will form. In addition, when your arteries become inflamed, it's more likely that newly formed soft plaque will rupture and create a blood clot that blocks the artery completely, leading to a heart attack. So you must pay attention to your teeth in order to protect your heart. This means brushing your teeth after every meal, flossing daily, and regularly visiting the dentist. 3. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. It arises from the normal biological process your body uses to fight off viruses and bacteria. In people with an autoimmune disease, the body mistakes normal tissue for a threat and attacks the healthy tissue along with the foreign bodies. Autoimmune diseases affect women far more than men. Rheumatoid arthritis causes a progressive inflammation of the joints, especially in the hands. But rheumatoid arthritis also raises the risk of heart disease by about 50%, most likely because it creates a chronic inflammatory state in the body, just as gum disease does. If you have rheumatoid arthritis, make sure your doctors are monitoring you for heart disease. Make sure you tell them about any possible symptoms. Number 4. Lupus. Lupus is also an autoimmune disease that produces chronic inflammation. However, unlike rheumatoid arthritis, which only affects the joints, lupus attacks the whole body, including the skin, lungs, stomach, kidneys, bones, eyes, and heart. People with lupus are more likely to have other major coronary heart disease risk factors, including high blood pressure, high cholesterol, and diabetes. This results partly from the side effects of the strong steroids used to treat lupus. Patients also tend to be inactive because lupus causes fatigue as well as joint and muscle pain. In fact, heart problems are the leading cause of death for people who suffer from lupus. Number 5. Sleep apnea. Research continues to discover that sleep disorders contribute to heart problems. Among the most serious of these disorders is sleep apnea, a condition affecting 10 to 20 million Americans, most of them men 65 or older. The most common form occurs because the upper airways become obstructed during sleep, causing breathing to stop, sometimes hundreds of times a night. This sudden drop in oxygen alarms the body, causing the release of the same fight-or-flight hormones that raise blood pressure and make clots more likely. Recent research has linked sleep apnea to the kind of memory and thinking problems that occur as we age. Many people who have sleep apnea are completely unaware of it, but major symptoms are loud snoring and excessive daytime drowsiness. If you suspect you have sleep apnea, you should be evaluated at a sleep disorder clinic. Beware though, sleep disorders are big business, so many clinics are popping up. Make sure you choose a clinic with a well-trained and certified staff. Sleep apnea is also linked to being overweight. Weight loss often will correct it. Number 6. Too much homocysteine. Our bodies produce the amino acid homocysteine when we metabolize another amino acid, methionine, found in protein-rich foods. The B vitamins, folic acid, B6, and B12 then convert homocysteine into still other amino acids that the body uses. so some homocysteine in the blood is good. The normal level of homocysteine in the blood is 5 to 15 micromoles per liter. Some studies indicated that too much of this amino acid in the blood could damage artery linings, increasing the risk of coronary artery disease and possibly accelerating the formation of blood clots. However, subsequent studies did not see a link between homocysteine and increased heart disease, so the question still remains. Still, to be safe, you might want to have your homocysteine level checked. If it's too high, 30 to 100 micromoles per liter is considered moderately high. More than 100 micromoles per liter is severe. You should consider taking a supplement of folic acid along with vitamins B6 and B12. Number 7. Erectile dysfunction. Erectile dysfunction isn't just about sex. It can be a symptom of a much larger problem. If a man is unable to maintain an erection sufficient for sexual activity, it may be a sign of coronary heart disease. A study published last year in the Journal of the American Heart Association found that men with erectile dysfunction were 1.6 times more likely to develop a serious cardiovascular problem, such as heart disease or stroke. Coronary heart disease is caused by the development of plaque in the arteries, which inhibits the flow of blood. One part of a man's body that depends strongly on good blood flow is the penis. Of course, it's tempting for men to turn to sildenafil, Viagra, as a quick fix. But Viagra can be dangerous if you have coronary heart disease and you're taking a nitrate drug for chest pain. Number 8. Low hormone levels. Testosterone levels peak in men in early adulthood and begin to decline after the age of 30. Research has long indicated that normal levels are necessary to maintain good health, and that levels that are too high or too low are linked to coronary heart disease. Not surprisingly, older men have lower testosterone levels than younger men. As many as 30% of the men older than 75 have levels that are much lower than normal. Men with very low levels of testosterone not only carry an increased risk of heart disease, but also face loss of sexual function, decreased muscle mass, fatigue, and more. Whether or not postmenopausal women should receive estrogen replacement therapy is an issue that has seesawed over the years. So if your estrogen level is low, work with your doctor to weigh the benefits versus your individual risks. The same common steps that help protect your heart, including eating right, quitting smoking, and becoming more active, can also help resolve risk factors for many of these factors, such as stress, sleep apnea, and even erectile dysfunction. If you have any conditions that heighten your risk of heart disease, taking action now could not only preserve your heart health, but it could save your life.